This video is going to go over how to set up a secondary or piggyback infusion, hang it, back prime it, and program it. So if you're having trouble seeing the pump because it might be hard to see the screen, you can always refer to your step-by-step instructions, which are in the lab, as well as posted on Learn. So since we've mixed our medication and now we've come to our patient's room with our mini bag prepared, we would want to do our third check. So with our third check, we've got our MAR with us, and we've already checked to make sure that this medication is compatible with the patient's running IV, and also we reviewed the hazards, in addition to our first and second checks that we did when we mixed this medication. So now our third check will be at the bedside. So I've approached my patient's room, done my hand hygiene, of course, introduce myself, and then I'm going to make sure that I have the correct patient. So I'm going to check Parsio-Parsons, compare it to their name band, and also one identifier, so the date of birth or the MRN number or FIN number, and make sure that matches as well. I can also ask my patient as well, can you tell me your name, please? And they will respond with their name. Can you tell me your date of birth? And they will tell me their date of birth. Often patients don't know their MRN or FIN numbers, so don't usually ask that one. So now that I've identified that this is correct patient, I'm also going to make sure that I have the right medication in my hand and that I haven't accidentally mixed up my mini bag for someone else and brought that one into the room. So with my third check, I've got my MAR with me, and I've also got my mini bag that is labeled. Vancomycin, correct drug, and also 500 milligrams is the correct dosage, 500 milligrams, which is on my MAR. It has not been given yet. It is due to be given now, and it's given IV, and that's what I have here in my hand. I also, with my second check, I verified with the PDM that this was mixed correctly. Okay, so I'll let my patient know you're getting vancomycin. You have an infection. Did you know that? And just make sure that they know that they're getting this medication. They have a right to refuse, and I also let them know that there might be some side effects. So for example, you might develop a rash once this infusion is going, or you might have some wheezing or difficulty breathing, and these are all listed in my PDM. So if you don't have drug cards with you, you can always take a look at the PDM, and they will often have the potential hazards that you can let your patient know about. So is it okay if I give this medication to you? And they say, yes, that's okay. Okay. So now I would also want to check to make sure that my infusion is running at the correct rate, and I will know that because I'll look at my MD orders, and it is running a normal saline, 25 cc's an hour, 25 mLs an hour, normal saline, perfect, and it's infusing correctly. All right, so we're going to want to attach our mini bag. So for the piggyback, it's going to draw from the bag that's the highest. Okay, so we're going to put this bag lower. The primary bag is going to go lower, and then we're going to spike our mini bag and put that higher. So we'll take off that protective cover. And we're just going to make sure that this is clamped. If this is unclamped and I spike that bag, you'll notice it's very short tubing. So what can happen is the solution and medication will start flowing right away, and you'll end up with medication wastage because it comes out of the tubing and ends up on the floor. So make sure you have your roller clamp closed so you don't waste any medication. We're going to hang that up, and then we're going to grab an alcohol swab. And we're going to find the port that is above the pump. So you can see the port here still has yet to go through the pump, the tubing. So we're going to swab this for 30 seconds, dry for 15. Okay. And we're going to take the cap off here. And we're going to attach it to the port. Okay, so it is attached before the pump. Okay, now the problem is now there's air inside this tubing. So if we started our secondary infusion, it would pull air into the pump. So we want to do something called back priming. So we're going to take our infusion, we're going to lower the bag, and just watch to see what happens to the air in this tubing. And also take a look and see what happens to this chamber here and the drips that are flowing. So you see there's bubbles flowing into this bag, and you can see it's pulling from this bag. So our pump doesn't know that we're doing this. You can see it's almost like a Y. It's pulling from here, traveling down the tubing, and then it's going to go into this tubing. Okay, so it's clearing all that air out, and the air is going into the mini bag. Now you can see I filled my chamber a little bit too much. We just want to prime just enough because we don't want to dilute our medication inside the bag here. So what I can do here, and then we'll roller clamp it once we've gotten rid of all that air. I can flip this over, squeeze it back into the bag, and flip it like that. Okay, so you can see it's half full, and that's good that it's half full because we want to be able to see those drips flowing. That's going to be really important coming up. Okay, so once I'm happy that all that air is out, I can hang my mini bag back up here. There we go. And now I have to program the pump. Okay, so we're going to have to stop it. Okay, and then we have to go to, scroll down and go to secondary. Now the one thing that we want to do as well is there's an option for it to automatically go back to the primary infusion. Once this mini bag is done, it can switch back to pulling and going back to the 25 mLs an hour infusion. I don't want it to do that because I want this pump to alert me when this mini bag is done, because I actually want to come in the room, make sure that it's empty, make sure my patient's okay, and then I'll restart this infusion. So sometimes in practice, you'll notice that's not always done, but we'll do it here in lab. So we're going to scroll down to the back to primary automatic. We don't want it to be automatic. We're going to switch it to back to auto change to primary. We're going to say no. So now you'll see it's on manual. So that means I'm going to have to manually come back and restart that infusion, but it's a great opportunity for me to make sure that that medication has gone through. Okay. All right, so we'll go back to new secondary. Sometimes you can use a previously recorded secondary infusion. I'm going to go into new secondary. Okay, and then you'll scroll to whatever medication. It's an antibiotic, so I'm going to pick there. And the total dosage is going to be the total volume in there. So with overfill, some of the bags will have overfill, and a lot of the facilities are starting to use overfill. Plus my medication, there's a total of 115 mLs in this bag. So I'm going to program 115 mLs. Okay, so we're going to go okay. And then the time, I know from reading my PDM, 30 minutes is a safe amount of time for this medication to infuse. So we're going to go 30 minutes. Okay, and then we'll go okay. All right, and then we can go ahead and start. Now one thing, and then it says, gives me a reminder, which is a great reminder, unclamp the secondary line and check the bag height. So it wants me to make sure that this bag is higher so that it pulls from here, because gravity is going to want to pull from here first. Okay, it's going to pull from higher. Once this bag is empty, it'll pull back, it'll pull from this bag again. Okay, so it wants me to check to make sure this is higher, and also very important, make sure to open the mini bag roller clamp. Okay, if you don't open this, it's gonna pull from here. The pump isn't very smart. It doesn't know what bag it's pulling from. Okay, it'll pull the 115 mLs from this bag, not knowing that it's not giving the medication. So then in 30 minutes, you're gonna come back and no medication has gone in. Okay, and then you haven't delivered the dose, and then you got to reprogram it again. So very important, undo your roller clamp, so it's going to pull from there. So that's a great reminder. So we'll start. Okay, and then it should be infusing. Another really good double check is let's make sure that there's drops flowing from our medication. So we'll check for 3 drops flowing. 2, 3. We know it's pulling from this mini bag. Okay. And then in 30 minutes, this will prompt us to come back and we will visually check to make sure this is empty.